My name's Colette Anderson. I'm a urogynecology specialist nurse from James Cook Hospital in Middlesbrough in the UK, and I'm here to talk to you about our audit data, where we compared percutaneous tibial nerve stimulation to sacral nerve stimulation to see which was more effective. I have no disclosures to make. So, we offer both treatments, Ptns and sacral nerve stimulation, at James Cook, and patients would ask me which treatment was best. So I looked at a literature search and found that there was no comparative data for overactive bladder. There was, however, one pilot RCT within the fecal incontinence cohort done by Thin et al. And the results from this deduced that RCTs were not feasible due to recruitment and cost issues. NICE call for more research into sacral nerve stimulation and Ptns and suggest these services should be audited. This presentation represents our results from analysing our audit data. All overactive bladder patients who had a test period for sacral nerve stimulation or Ptns at our centre and had completed bladder diary data were included. This led to 24 patients in the Ptns group and 50 within the sacral nerve group. The baseline characteristic data was limited due to the retrospective design. However, the groups were comparable in relation to age and symptom severity. Our primary outcome was the number of responders to the treatment. A responder was classified as a patient who had 50% reduction of at least one of their overactive bladder symptoms during the test. Our results showed that 54% of Ptns patients responded and 86% of SNS patients responded, indicating that SNS treatment was significantly better. Frequency, urgency, incontinence and nocturia were evaluated, and we found that most Ptns patients responded within only one symptom area, but most Ptns patients responded within 3 symptom areas, suggesting again that SNS was more effective. And there appeared to be a pattern in how responsive the symptoms were to the neuromodulation. Incontinence appeared to be the most easily treated symptom, with nocturia and frequency being the most resistant. So in conclusion, within our service, SNS was significantly more effective at treating overactive bladder than Ptns, and that was when analysed using responder rate and percentage reduction in symptom severity. However, these results should be viewed with caution, as there is a lack of randomisation due to the retrospective design and small numbers. Bias is likely within this study. However, if a multi-centre audit using a stratified sampling technique was performed, this could give more valid results. Accepting that an RCT wouldn't be feasible for these interventions, a multi-centre collaborative audit using stratified sampling could access the large pool of data that should already be available at the sites, utilising minimal resources and helping to give an insight into the effectiveness of these treatments. Thank you.
Please. Thank you. Please go.
Thank you, Lee Mai Chu from Canada. Thank you very much. I'm wondering because with the sacral nerve stimulation, you have that the permanent stimulation. I would like to know what is the regime of treatment for the patient with the Ptns, because they are still not only a few hours of the time of the stimulation and also the rate. How do you have the regime for the patient? How can you compare that to the sacral nerve modulation?
So it's hard to make it clear in the short time, but this was actually just a test period, so it was a percutaneous nerve evaluation for sacral nerve, and it was used temporary test wire. And for the Ptns, we did the standard 12 treatments, 1 week apart of 30-minute sessions. So it was just the test period that I evaluated. Yeah.
Sorry, Roger Walker from the UK. I had a similar question, but my other question was in relation to your results. At what time frame post-treatment were you evaluating the outcome?
So this was, for the sacral nerve, it was at 2 weeks after the test, they would come back, and it was the initial diary from the full 2 weeks. And for the bladder diary patients, they did the 12 weeks, they had a 2-week break, and then they came back with a 3-day bladder diary, and I evaluated it then. This is only the test data, but obviously if it went forward, we could look at looking at prospectively and collecting long-term data, which is needed as well.
Any more questions? Okay, then we have to conclude this session. Thank you very much.
Thank you.